We tested the drug crizotinib in 2 different variants of inflammatory myofibroblastic tumor. We looked at patients whose tumors had the ALK rearrangement, but we also included patients without ALK rearrangement. It was not a randomized trial. It's not the intention to compare these 2 groups with each other from a statistical point of view, but it was interesting to see that the drug achieved different things in the 2 different subsets of this trial. In the patients with ALK mutated disease, we found a number of objective responses. 2 patients among 12 evaluable, fully evaluable patients had a complete response of their tumor. 4 patients had a partial response of their tumor, and all responses were confirmed by a repeated CT scan. In total, we had 50% objective responses in this group. More interestingly, none of the patients with ALK positive or ALK rearranged disease had disease progression on trial. We had a clinical benefit rate, which is a summary of all complete and partial responses and patients achieving stable disease of 100%, meaning that this drug is very active in this tumor type. In contrast, in the ALK negative subset of this trial, we saw only 1 objective response among 7 evaluable patients, or an objective response rate of around 14%. The activity of the drug in that patient is somewhat dubious, because we would not expect that a specific ALK inhibitor would be active in ALK negative disease. We believe that this is related to the technology that we have been using to define patients as ALK positive or ALK negative. We used FISH and we used immunohistochemistry for that purpose. And of course, these are not ideal tools. And of course, the biology of this disease may be more complex than the simple issue ALK rearranged, yes or no. There might be other molecular players playing a role here.